My name is Don Tatalovich. I'm the owner of Cornerstone Dental here in Hayden. And my background in dentistry started actually as I shadowed my family dentist in northern Wisconsin, which is where I grew up at. And then went through some school for a few years, and then went out to San Diego, where I was in the Navy for about 6 years. Took a little pause from academia, and then I moved back to Detroit. That's where I went to dental school at Detroit Mercy, and then moved out to Hayden after that. So kind of a long journey to get out to Hayden, Idaho. But I'm here, joined Dr. Hahn here in 2020, and the connection, I guess, for the Hayden piece was meeting Dr. Hahn in dental school. He actually started mentoring me while I was at the beginning of dental school, early on in that process. And so after that, we realized there was a good fit there and a good opportunity for me to actually start to work with him. And so I came on, like I said, in 2020 and started up here. And from there, here we are in 2025. Dentures, we've had dentures for a long time. People have been wearing dentures for a long time. With implant-retained dentures, though, that's obviously a newer treatment modality. So with that, it's exciting because we have an opportunity now to fix some of the issues that people have traditionally always complained about with those dentures. With dentures, keep in mind that, for a little bit of background, traditional dentures, we're really getting that retention to keep them in place with the bone in your mouth, the ridge, so that height and that width provides that stability. There's also suction there, and so really relying on that to keep things in place while you're speaking and while you're chewing and any sort of movement. With implant-retained dentures, we have something that anchors those dentures in place, and so that's something that really gives the opportunity to rely on a stable, consistent, an anchor for keeping that denture where it needs to be at, so that when we go to chew, when we go to speak, as we're moving our mouths for whatever reason, we're not concerned about loss of function. We're not concerned about that like falling out or moving to a place it shouldn't be. And so that's really, I think, an exciting change where people have that anchored into place where they want it, and it makes everyone a lot more confident with that. Implant-retained dentures versus traditional dentures, and so I actually have a couple models here I'd like to show you. We've got a traditional denture here, and so with the traditional denture, kind of talked a little bit about the fact that kind of fits in somebody's mouth, mimicking the shape of their mouth, and this is an upper denture, and so this would fit kind of across the roof of somebody's mouth here. And if we imagine this is kind of this weird contraption is a model, so it's a simulation of somebody's mouth. And so the way that traditional denture would fit would be right into that space on top of their mouth there, and that's going to stay in place with suction. And so that's something that, like we talked about, there's some limitations to that because we can really only get so much retention from suction there. When we talk about an implant denture, we're talking about, here's our model again, simulating somebody's mouth, but now we have these anchors or implants on their ridge, and that'll keep that denture in place. As we look at the underside of this denture, there are little correlating snaps there that'll snap this into place on the ridge. And so then as we snap this into place, we're not relying so much on suction as we have an actual physical anchor keeping that in place. And so that's a big advantage to having implants on somebody's ridge there to retain that implant-retained denture. An individual that's a good candidate for implant-retained dentures. So the things that kind of dictate what we're able to do with implants themselves will kind of dictate what we can do as far as implant-retained dentures. And so if an individual has an appropriate amount of bone height and bone width to place that implant, then we're able to put that anchor into place and then build our denture off of that. With that would be something that we would, in order to determine that information, we'd want to take a look at a person's mouth, their teeth, and really evaluate their particular situation. We would want to also just kind of talk with you about, availability of bone and what we would expect to see through that process in a consult as we kind of come up with the best plan for each individual. Expounding on the conversation of what prosthetic might be right for me. I think when you categorize things, you'll kind of come up with two big categories of, is this something that's removable, or is it something that's fixed in your mouth? And so a lot of times we'll see with different marketing and advertising, they'll say full arch or all on X, where you're talking about a certain number of implants to retain a bridge, like a fixed bridge in your mouth. Traditionally, we've kind of talked a little bit about traditional dentures, those being removable. And so when we kind of segue into implants, now we're talking about how do we make that removable prosthetic fixed. And so we're able to snap that in place and overcome some of those traditional challenges of a traditional denture, being that we have only so much stability there. And that stability is what we need as we put chewing forces down on that denture. As we speak, our lips and our mouth, our cheeks move, and like we have gravity trying to pull that denture down out of our mouths. And so as far as what benefits do we get, really a lot in the way of additional function. With speech, we're not concerned about that moving while we're speaking, so increased ability as far as speech goes, and then also just the confidence that that's not going to be displaced while we're doing things in public, such as speaking and eating. What does this look like when I come in to have some sort of treatment done? And am I a good candidate? How do I answer all these questions? So there's a lot of questions. There's a number of treatment options for somebody. Each person's a little bit different. So the place we like to start would be, we'd like to meet with you. We'd like to sit down and talk with you about your goals, your expectations, some of the limitations to different options that you would have. And then after that, we can come up with kind of a unique treatment plan for each individual. Once we've settled on the treatment plan and the treatment style that you're comfortable with, then we can set up subsequent appointments. For a denture, that would be something where after we've determined that a certain number of teeth need to be removed, then we would see you for a surgical visit where we do whatever surgery is necessary. As a patient is leaving the office that day, we have somebody wearing what's called a healing denture, a temporary denture, so that you can leave the office with a smile. You still have teeth, so that you can speak and start to work on functioning with the denture. After healing takes place, there will be a number of months of healing that are required. Then we'll come back and we'll reevaluate everything and we'll make a custom denture. We can use that healing denture as well to kind of determine your desire and your needs as far as aesthetics goes, and if there are any changes that we need to make when we go to make your custom denture. Some misconceptions about dentures and implants. So for dentures, I think that sometimes people will think that once we get this custom prosthetic made, then that will be something that might last indefinitely. For a denture, we have to remember that the tissues, the bone and the gum tissues in your mouth will continue to change over time, and so the fit of that denture is gonna continue to change. It'll probably worsen over time depending on how much a patient's gum tissue and bone tissue changes. And so that will necessitate either coming back and modifying the denture, or in some cases continuing to remake it over time. With that, the other thing that we'll see is as we're eating and chewing and speaking, wear happens to something like that as well. And so these are things that we'll need to come back and again repair and sometimes replace over time. For implants, that's also another good question. I think sometimes we think that if we removed a tooth, we removed infection, and now we've placed an anchor in the bone for a new crown or new denture, this is something that might not require care. We need to look at this though, similar to a natural tooth, where this is going to require consistent, diligent home care, as well as checkups, so that we can make sure there's no bone loss around that implant or infection happening in your mouth. If you're looking into changing your smile, whether that be, you think you might need an implant or you might need dentures, really the next step for us would be, let's get together, let's take a look at teeth and mouth. Let's figure out what your goals are, and then we can come up with a plan, and we can figure out what your next steps would be, and then we can start to treatment plan and come up with a game plan for you.